Thank you. Welcome back, everyone, from the virtual presentation. Commissioner Nastash would like to say a few words.
Minister Neto the Moganta Deno Disha no Chada Dagmano then we should the Sonana Magdanui a Pohogadone Nabenudiska in Ken Barter Nigadano. Mr. Media to Ponanit the square Negatone Negatchot Motsida Newfoundland government Negatone way to at the squat. I want to notice no that Ponabot has Negatagno the Sono. Noji he to da ke skut majid noji ha. Ego bueno to endo mani bini ji I know wa we dagne de kai hot set kai hoa dagne no to so no ka to daga et the squat chujmo. Ego no I know to endo madan mne no ji to dag mag ji chi da dag mano no ji ji Mr. Mishkut ji bana go je wana do to in the eswa tak. Ego no I know I don't know the madam. Did you do that? So I'd like to say thank you to Ken Barter for your presentation this morning. And I just gave a brief background of Ken and where he came from so that people can understand and in my language. So again, thank you, Ken, for your presentation. And I know that it'll be very useful going forward when we're doing our work. Thank you.
Thank you very much. That was translated into Inuimun. And now I'll ask our lead counsel, Caitlin Urquhart, to put us through the next steps.
Thank you. First, we will ask Inquiry Manager Ruth Steele to affirm and also clerk for our hearings today to affirm the witness.
I don't know if you can see me on the screen, but Dr. Barter, I will just ask, do you solemnly affirm that the evidence you shall give to this inquiry shall be the truth, the whole truth, and nothing but the truth?
I do.
Thank you. Please state your name for the record.
My name is Ken Barter.
Thank you.
And to begin, I'll just ask that you confirm for the record that that was your evidence in the presentation we just watched and that was accurate.
Yes.
Etanto hemasteta enonte cheki egni shatagno na peo ken enonte cheki no jimano mishinano nante che utia de no jejita boita na to sen maganda heniucha magano et stad menu stad mohana nam habten siha.
Where Commission Council asked questions during the presentation, we've concluded our direct. So we will now hand it over to the Innu representative organizations, represented today by Victoria Wicks, who is on the screen there.
Good morning. Can everyone hear me okay?
Yes, and we'll just wait for translation one moment.
Representative Victoria Wicks.
Good morning. My name is Victoria. I am counsel for the Innu representative organizations. Thank you, Dr. Barter, for your report and your testimony. I just want to note that I will be pausing for translation and will indicate when I'm doing so, and I will do so now.
Victoria Wicks makan he den henwa yaga wajaga den he et wad the khana snakhamten na no shiga munchina ken dagnani eno mushanagno kaji shihanji.
So I wanted to start today by asking you about the various child welfare reports that you reviewed when preparing your own report. And I wanted to just start by confirming that several of those reports did recommend a prevention-based early intervention approach. Is that correct?
Yes, indeed.
I'll just pause here for translation.
Paganonte quechmadonante mishanagno kushitano ni atante sihanji chantente no enonte no mushanagno cantestada enonte tokunantante gente kucha enonte intervention hatuma enonte jeji canas pencheguana engudanan tokuno cantestada mushanagna gente.
And did any of the reports that you reviewed recommend against a prevention-based or early intervention approach?
No report that I know of would recommend against prevention. All of the reports basically see the importance of early intervention and prevention outreach.
Maganante gente kutsena enonte mushan knish kanish kawishi tante intervention ni atma tokuni banan to kusa gente chat to kuyanante nante hechwa enonte intervention ni atma enonte everything is happening to gonte chandante jejno jeji to tukin intervention ni ata eno jejin to se tante efnita.
Thank you. And so I understand that the key issue, or one of the key issues highlighted in the reports in your report, is that there was a lack of adequate resourcing to actually implement that preventative approach. But you said that those resources never came. Do you have any sense of why that is, why those resources never came? And I'll just pause here first for translation.
I have a sense of why the resources never came. It would be my opinion, and I'll speak to my experience with being a member of the Ministers' Advisory Committee in reviewing the Child, Youth and Family Services Act of 2000. I was a part of the Ministers' Advisory Committee to see if, in fact, the Child, Youth and Family Services Act was achieving what it was intended to achieve. In my opinion, the Child, Youth and Family Services Act was a great piece of legislation. It marked out a future for child welfare in Newfoundland and Labrador. Yes, it wasn't perfect, but to my knowledge, in every document that I read when the act was enforced, there was never a recommendation to replace the act. When the act was discussed in committees, in reports, in forums about child welfare, it was always endorsed as a great framework, a great legislative framework. It just needed resources.
Okay, I'm going to stop you there for interpretation, sir. Just 1 second.
Enonte kutsumo kuenona enokwesi Victoria ha enonte ntante matawajente ka se hecheta na chekwano chekanochi muchenonte chekwanonte enonte kan siwechintante intervention mageno mshweketagachwa enonte ntante habeche petegeta ntante advisory committee kan hatama na pewi ken gniha magenonte 2010 te chat kuni benemes nan kan te nonte he chigan te show some child welfare act ni hada hangne non to chante eswa pahman to contente she ke wineno esna ko hagane chmisnan kan
tukunante tabuche kwa niu chantante she esihan chisto tukuna ma chigana shinaguna ego mishogan tuko cham manustewniwa tante enwante she waseno cha tante generation shomagan chigana she todoagna engunan mishinanaganiwa ego mishinanaganiwa bajniu chanta Danio unapaha henuin cha matuganda jago absenio chigana enne wehi sagan to missionan gana chawl ferakta ego tandante geniu cha missionan gani dai the stage new cha manusteo chigan chigabe buan the steo moko matugodan tabse chagwan new chan chigan nasin chigan nishnaguni bina matugana chagwan new chan tande chigatuguni bini mag matta wajin jwenji chigat khat tumajin cha and our resources gonna hiatya
Go ahead.
Yes, and as we were completing at least the minister's advisory report, it was acknowledged again that resources were required, and that recommendation was in fact made. There was no recommendation with respect to changing the legislation. It's just that more fiscal and human resources were required. And that captures a fair range of what those resources were intended to be. Primarily, like for example, more therapeutic foster homes, more home care supports, more emphasis on prevention services, early intervention services, more in terms of lower caseloads for social workers, which requires more kind of social work staff as well. So these were the kinds of resources that were constantly being advocated for, and they were never given to sufficient capacity.
Maganante gente ko chai gente ko tante he esi hanji tante che mishan ne wehi ta gna jenish na ko haganja eno tabu mtuka je ko tante he to ko nante he chikanish na ko hagni bna chikan funi bna tante he je ji ta chin tante to ko hina pse je ko ka e to ko hia eno ante shen Jeji datchen je weji gad se cha mtuko na tante he mishan ni ta recommendations to ko den eshu weji ta ganja mtuko na recommendations to ko jeji a shiben jen je se je kwa na jen to mag je kwa nan je ka she ji ni ben tan to ko mag da te she ya o wen ji je ga ta jeji gad se cha wen ji jeji wi ji no cha mag je ga to ni ben to ko prevention and jeji ga na fen je kwa na I was naganta nen mishnana gana net staganja magan chagatu guni bento ko wakhajan tante he wet nagan ji was jeji eton to seni saganja jegwan ta funjan te magan den he etto ya chagata banjan to ko mi jimjima banjan to ko jeji ta khata senon to ko enon te she esna wana ego chagana naguni bento ko engun mattogonyo mantashna ganunya.
Thank you. So my understanding from your report and your testimony is that the current system has not taken that early prevention, community-oriented approach and instead taken more of a reactive crisis approach. And so I'd like to discuss some of your critiques of that current approach. To start.
And pause, please.
Tante gente ko ya cha khamatan to kana gachi anu mata magda chim shana ni hin to kana chekwa no ante he kan to kana ji tante he no chechno de ji no ji kan cha ji to ka nya prevention nya ta magno ante he nation ka sha and kamen bunja tante he ji Tawin kan swet mo siya nang siya kuna no was makuta magtante he tanjigan siya na kuna tan tanjigan siya to tigni banana
So in several places in your report and in your testimony, you talked about how the current system doesn't adequately address or deal with root causes of child welfare issues. Could you expand a bit on this? What do you mean by root causes, and how does the system not take those into account? And I'll pause here first for translation.
The root causes,
Oh,
and
I think I'll
they're
pause first for translation if that's okay.
Nante she gawi sama tante hen to chante hen mashana kani sha nante he chekwa nante he na sete chika na tagni bini na chekwa je jijita ba hen je nante she kamen do bunja kai to ka shia bja ma ke nante she tente he wincha tente he ante she je ji wi sa hen no to nante she knish ni hat man ko root causes ni hat mo chan tante he tan tente he chika na fini bina.
The root causes, those two words were mentioned specifically in the report prepared for the premiers across the country on the report on the over-representation of Indigenous children in care in Canada, which at that time, 2015, still very much today, which is considered, I think the words of one federal minister was a humanitarian crisis within the child welfare system. And in the Premier's report on that very topic was things will not change until root causes are addressed. And these root causes were embedded in issues of inequalities, food insecurity, poverty, inadequate housing, accommodations, not sufficient resources for mental addiction issues, and the list goes on. Like unless you address.
Pause here, please. Thank you.
She to cha tante ni sha kana che kwan to cha nante she chikan shna go chen we shi sa kan chen me shna kan chen shna go chen shna kwa sha and tante she 2015 and to go and when ne khwe shna kwa to go shna kan ne wi bi chiga shi sa kan chen to kwa kan si hwan ma chen shna kwa sha tante he che ma shwina ma kan tante she and tante he ne shna kwa ka men no pun she crisis kan ya mo and the che kwan f and g ka men no pun cha. And when the average and the machine and the average took an even down on the head church mom machine and gonna and no road causes as you had new and on the catchy tabac and one chan check one F and cha. Then the heavy point one no jam and the hair and the check one medium guys quasha guys check one no sevens and then the you know what the nasha went check one no sevens and 20. Mi drive on a bit north ebona new and gonna anteo chegua guys quite hinter and the chica where the stag even in chegua and Janish total and Janish reach aganacha. Maganante on now and the average guy the questions guy touching got the search and when she did you judge a dictionary had she were no gaji bunny who much you can know and gonna know but to go. To go on to go on to go a as a cat guy to go in down to go not to get you bath and nipnia.
The current system, child welfare system in Newfoundland and Labrador, says that it is child-centered. The research and certain comments in my report based upon the literature would challenge that. And the way that the literature and the research defines child-centered practice is doing things for parents and families what they could do for themselves if they had the resources. Thing is, the resources are not provided for them to do that.
Mutta kun noin antaa, kun sääntiin, että se vin, että he chavo ferkentia, mitä mä hintia, että niin fulan mä kan tehdä labdor. Annan tehdä tskajita bahag ni bin siswente on sääntaan tehdä ino wassa ja. Tseguano annan tehdä kamen bunji tseguano annan westa bunjia. Ego tadan tehdä tsegan no jih ni bin ya jeji to kwa hin wen ji jeji wijagan chenche. Guamo jo hamoja wassa ja but. To kwa hi ta chenche ga to se cha buja jeji wa wi je chenwa wassa magano ana wi han shmoja.
Thank you. And so is it fair to say that one way to provide those resources to families is to ensure they're better connected to broader social services?
Definitely.
And in your
That's-
sorry, go ahead.
Connections is the key. And when families are struggling with challenges, be it health or structural issues of housing, food security, and so on and so forth, unless you deal with basic needs, you can hardly expect people to act at their fullest potential. Basic needs are very important. Housing, food, shelter, clothing, social relationships, sense of belonging. All of these things are very important, and they have to be attended to in order for people to move forward.
Heno tehe tu kan yu chan dan tehe chegwa no tehe kai tu kun chi no dan tehe chi chen khman tu dan de ma kan no tehe ne sha kwa yu cha de chiga wi cha ni ben je tu mnu cha kan chan dan tehe win den tehe win mi jim ma ho ta ha e shna ko ha tu na ne de hin sta e to de je chiga tu ni ben de na tehe cha han che to ko no ka me no kha ko chuen ji an chen te na ena o samo como we han shmo and want he chaka to ni bani chaka na shwi chaka no cha che ji to ko na cha bich mi chim no ma ga non te he che ko no ante he e ya no ante cha e ni no ante he ka chaka to ni bani ni tante mat e ni no mo de he no chi ga te he mi cha na de he chaka mi chim chim ju no na sa chaka ji ta ba mo ja che kwa na de he no se ben chuen ji mi chim no bo de no ka ta che kwa pa bu ji ha cha bo de ma ke mi chim no bo de ke de chen ba mi jo avi sha mi jo af no ya ba ja e ko da de he chaka ji ta ba ni bna si ho.
In your report, in your testimony, you've also talked about how bureaucratic and top-down child welfare systems have become. And you spoke a bit, for instance, about how this can impact the morale and the effectiveness of social workers. I'm wondering if you can tell us a bit more about how that top-down approach impacts the day-to-day of a service provider. And I'll just pause here first for translation.
Magandang she no chegwan to chan tante he kan si het tante she na mi chim chim ja den he the stagan jam shang she wet the show magandang is mi chim chim ja kan she to tasa edwan he ji kai to kun chi nan te he no chikan she to mo ban ja ego tan chikan she agni ben to ko non te she win wa win en te she chikan she ji no go chen cha chikan she to mo ban je to what the se no nan te he ji Monastenji no chegwa ka monastenja nchaka to se chen te na mi chima.
It is said within much of the management literature that one of the biggest issues that we have today is the result of the bureaucratization of work and relationships. And when you're working with vulnerable citizens and families and communities, things have to be not so much policy driven as driven by people's motivations, incentives, dreams, and wishes. Where the bureaucracy comes into play is it puts barriers to being able to have professional autonomy in the field, autonomy that professionals require in terms of professional discretion, in terms of authority to make decisions, in terms of high risk situations, to be able to take risks in partnership with others. The idea of being able to include others, to be inclusive, like these are things that you cannot put policy manuals around. These are professional, ethical, work kind of practice issues that I believe the bureaucracy, particularly for frontline social workers and others, the bureaucracy stifles that professional integrity, professional autonomy, and so on. And that's been well documented in report after report by the Canadian Association of Social Workers.
Magandang tugutsana chegwa nante she change and chegado se chabja and nante she jito kunijinante she dente he the hatas et when out the sono chente he jeji to kwahina na jeji manajwit with the semachan dente she kevino dente she the secha and nante she nafanonio no mishnana gna dante she Kai esto kun jinta en ante hen tente he no wenjia anjinno en ante hen isto bahaswa man to sei mo jeno ante no ka se he me shiga ta intente he ji to se cha bueno na ga wi ji to se me ma ge no ante he tan mo ka no na hat mo jente no mishna no en ante he kan sted mishna no winwa et no na hata sente ma ge no ante he Chikaji yaban jinjin de chaji ma cheno agataga gado sehinji ajeji sen macha maganon te hejeji nata jeji yatsa etumana sen macha tande mashina no na hatumujin de gudeno mattukunno tante hende chano jegono jigana se tot mubunjin da jen shui chachi no te henwa wenwa Mukweno mishnan no etestanje no nata sinte magandende she mishnan tente gente nisi ho changun etestage niwa and yeah but just got to say and frontline kan hatana workers got to say and on the hedge kan het hat manibnia.
Thank you.
It's also been documented in several reports completed in Newfoundland and Labrador. I think Deloitte and Touche did an organizational review. And social workers were saying in that review that the amount of time they spend attending to the needs of the organization oftentimes outweighs the amount of time they're able to spend with children and families.
Tante mishana kan ni cha et sihoten mishana kan ni at stage no tante she mun fishu jin dag no jin na ga to se chin kams in mesika ta ya michin fishu chen ya de ni o tante job no ja mun fishu bna je ji ta chin tante he ga to se cha ai kun object es we kan jin tante he mishana kan ga shi sa kan jin
And there have been incidents where, particularly since the Zachary Turner death, where social workers have been on record to say they are afraid. They're afraid to make decisions. They're because of the not getting the support that they require and not having the professional discretion and autonomy to really act in the best interest of the families that they're working with. And there is that fear that they have.
Magandang tahigan na Finsberg watcha wan you na tahiday na bisa secretary was na kan patente secretary kan hier hatten anje kada sa hechin jinte chash eno questa sente chaje ji todas si ho jinte mi jim jma eno je ji si ho che kon na tante kan de sho sama ja tante si ho jinte ya bche mat kon da je ji wi jin ko na ha je ji support to kan cha je ji ja kan cha ma kan te she ya mo kon tante she ni sha je ji todas no eteni hasa tante he je ji mananja instant.
Thank you. So there was some testimony earlier in the inquiry from Miss Lila Andrews, who was working as a zone manager, and she spoke about how she didn't have a chance to be involved in policy making. The local office didn't have a chance to be involved in policy making when child welfare services were part of the line department in government. In comparison, when the local health authority was delivering those services, she felt there was more flexibility to come up with responses and programs that weren't necessarily mandated by policy. And so I'm wondering, would you say it's fair to say that's an example of sort of the way that local solutions can be more flexible? And I'll stop there just for translation.
No te have no te se kai ento ka no metente na Laila Andra and we got the second intention is mitmash and the zone manager and on te se what I henonist ka na fiskite no jeji to ta henonist tante he with the short condition te mitmash ta chojma egon to ko chain kwante se chikan enon te ka wa wismentia egon chikan enon te to se hen to en kwan chikan funon to chan tante se jeji manda punchan tante he jeji manda stagan ji tante he win enon te ka wa wisa e ka tante ka effici tuina tante en kwe pe ka the assistant he mi jima.
Yes, I would agree with Lila. Most certainly, when services were under the umbrella of the health authority or the health boards, there was more flexibility. There was more of a concentration on preventative services, for sure. The community health boards were, unfortunately, when government decided to pass down the responsibility of child welfare to the boards, what government did not do was tell the boards that they were passing down a system that was in dire crises. And that left the boards being overwhelmed. And again, having a responsibility for a service that was under-resourced. And I recall conversations during those years when the government was told very clearly by the health boards, if you're going to be passing this legislation and giving us this responsibility, you need to give us the resources. But those resources never came.
Magandang tihin to sana nantehet nantehe win esna wa hento kana ne takhanwa nantehe chagan sina kuni bunje jimno punja anta age jeji ta chen wenji ga de secha and nantehe prevention jeji no jasa jeji ga na funje wan magandang tehe ya anja bach anja ga de secha dan de betchen dan de board and the wedge mouth makan je choj ma hen den to go cha e ko dan de ka men bun den to go en o de je to das to go dan den je ka betchen dan to go cha we sha me ko no go je non to go en o je chi ta ba se no de je dan de met to go no na met ta no na we no je wi ji no ko chen to dan de je ji to set to ta khat men ja e dan de hen na no me ha ta ni ben to go ab je no de je e wi tas ni sen je e board kan je ha dan da we mo cha dan den no we ka me no bun chen to go no me na na no e no de je met to go nan tan to go je ji mi no go mi na ga chen no to go no je ji bueno esto je ji tu we de je ta je no je ha je ta khatta ha ba ja je ji ta chen resources ni ha ja je when ji je ta khatta se no.
I'd like to talk a bit now about sort of looking forward. You said in your presentation that a new system is necessary, not just one that makes things more culturally appropriate. And the focus should be on, proactive, a collective approach, community and health focused. And so I'd like to know from your perspective, what would a proactive child welfare system look like in terms of the steps that staff should be taking? And I'll just pause there for translation.
Treatment nabs and when they want what some good on a hitchaka and want to hear what hatch and to when on the no at the hanwa and on the Chechi Nishna what then they say and Asian new to ya Magano Chegano no Yaganji Ash Mahaganjia Magante de she win Jeji to Dante Shemukwa de Otina Jeji Tabasni Chegano Nante she Chagana Funua Magante he meet Mitchmasha then the she Dan Chaganish always to always stagno always stagno. En on te hejeji en on te hejeji tanja gan se tot mo ni sen jo ji addo se chinda ta khata se no gtno.
What would a proactive system? Interesting. I was listening to an interview just the other day, a CBC interview with the former Prime Minister of Finland. And she was talking about her baby box. And the interviewer said, a baby box, like what? Well, she said, in Finland, every newborn baby and mother is given a baby box, regardless of income, status, whatever. Every child that's born in Finland is given a baby box, which is everything that a newborn will need. That is a proactive system. We need to spend more time on preventing maltreatment than on involving ourselves in families after maltreatment has occurred. that would be a proactive system. We need to be the biggest child welfare system that we have are the schools. We need to be involved in the schools far more than what we are. That would be a proactive system.
Kun tuoja tante hentuko nusi tante henna peho antuko tante se CBC anu mata kan tuko na peho na ayente kan student and on the farmer wana whatma anga whatma whatma hunte whatsango ayatente anu mata kan no anu mata mata kan baby box niya daw and was miutak kumjagan niya daw China. Den der Finland den der katungen der siya asine den Finland niya det. Nasihan der minagni ben was der no enuji was no mish no miutak na baby box niya daw. Egon mishwenta tukun jagan niya cha miutak was no der was jaganis abjiha Mashwenta tukununte en kunandeshni hatman tukuegta en on the proactive system ni hatma aweno en tganish nagu ni bana en jenish tganish nagu hagana en kunan weshni hataha en on the juegan funchegona kan funchegona janda je tukunan tante hen tganish totgna en kunesh ni hata to proactive system ni hata to jihad tgaman stagna jihad na tgastewa egen der tganish totgni bente ga khmaje javi hin to ji da batgan jegona den de ni fnj jegona abja jihad tgawi tgni bana ji manastagan ji at khatgan ji jihad na mshe jega manastagan ji to kashi.
Let me interrupt for a moment. In consideration of the time, in consideration of the well-being of our interpreter, well-being of our witness, I need to know where you are in your cross-examination.
Yes, I just have one last question.
Please continue.
And so you've noted that the prevention approach would also require building community and local capacity. So I think that relates to your last answer about getting involved earlier and taking more of a community approach. I'm wondering, what do you think are the steps that are needed to get to that level of community connection and trust between not just, for instance, the parent and the child welfare system, but also with the schools, with the police, with other community stakeholders? And I'll pause there for a translation.
Maganon te heka o ita he no te ntugueno te se prevention kana si hatuma. Egunan te se jeji astagan te jeji toka se kewina jeji se jiti te se magan te se wino te et noj te ethach wo te namas wentia. Che cuando antes se chinen tante gente ko chasti ha tante gente to contente se tante gatta pachmuta en antes se switch kan switch ak ni ben twenty tante kan se tot ni ben antente se otena sa che cuando tante se chi gente ko ante abji hagen gente ko tante se wina tante se chi sen mo to chenchu ante wino ka se sama tante se chi manot nas jejiwa withas chegwa abza jeji at to kwa intento como je no trust ni hade jeji mamuya at the khada sa jeji manopucha 매운 주먹은 뜨거나 미주면 주먹은 뜨거나 아까뜨거 전전 뜨거 지가 세션 뜨거 가마고 노해치마 근주 왠지 그뜨거 지가 세션 뜨거 근데 미주면 주마 안지마 뭐 지가 뜨가 뭐 번째 너한테 시 F는 지야지과
Your question again, please.
Just what steps do you think might be worth taking in order to improve levels of trust between community stakeholders to get to that early intervention prevention approach?
The question is, how do you establish trust? And how do you establish confidence? And one of the critical questions in my report is the trust and confidence there? And I don't know, I would need to understand it from both parties. Is it there? I don't know if things that are currently in place are working or not working. One would assume that they are, but who knows? Is the protocol working? Is the strategy working? And if it is, then obviously there is trust and there is confidence and there is collaboration, not cooperation, collaboration. There is a difference. And I believe the emphasis has oftentimes been on cooperation as opposed to collaboration. And the difference is you can cooperate with something, but you're not invested in the end result. But when you collaborate, you are interested and you are invested in the end result. And that's a difference. And how do you establish that collaboration? It's building capacities within the community. It's earning the respect. It's earning the trust. And it's being able to show evidence that positive things can happen.
En antes ya butcha tuko en antes ya 제가 나한테 제가 배모하던 지난테 해제 너픈지야 나제 다와서 근지야 너신하고 난 제지야 노지 근지나 제가 나한테 제 주고 있더고는 또고 너너 너한테 제지 다보다 호주인지야 제지야 trust 도다도자 근데 야 제지 도다시 가도 세신데 제 못되나샤 마게 너한테 제 prevention approach 그냥 동안한테 해 제 다바 행지 아버진 제지노 지금 prevention 는 어째과 아버자 는 아주 위시 에지노 지금지야 마근데 제 단단한데 해 단전 다이시 또다세는 또고차 단데 해 단데 해 지간 시도 된 또고는 한테 제지 trust 또가샤 제지 na fiiten ihminen tanto jeji ja tabu hähuneka tabu hähuna tukaisia tende se misnan kan non te se wisma kwa tukonan tache kwan tukon tante he misnan kan hin tante se en want he jeji wi de sem to nan jin de tukwa pot ba ke jeji gat wi de sem to nan ja tukonan tante se na atokani hin tukwa tukonan 지금은 시대와 막은 대신 제지는 대신 안난 대신 collaboration 해야 되마 단 대신 윈 두고난 단 두고야 붙이는 대신 에는 대신 지금도 대신 단 대신 제지 문 시대 자진 수시 사근진 안 완전하고 하근자 에고 단 대신 두고난 대야 붙인 두고는 개야한 두고 그만 너 돈안 너한테 과 막 단테 해제지 에야치 uithmatut keinoa jegua cha dante he jeji tabuetha honan cha tabuetha hon tukas magan mia jintona magan dante he jeji manopon jegua tukwa jeji manopon jegua no wajit wato tukan cha wajit sem tonan jen tukwa tukunan tan tukwa magan dante she katagan dante she jegua tukwa anante she we jeji eto seji wea chikui tanwana kataga jeji nat eno beba jeji nat to hena nista no te he wan to tagna cha me onan mo kun to no cooperation ni hat mun ni hat mun ania chikui to kun tan to no collaboration ni hat mo na pe engun je tgan fniben to no te je is an jeji to kwashin to ko chano te he jeji mit ya gna na shato to gna jeji ushi ta gna jeno chakam sta gna chakam ste unden te he ne ta khat ta gna
If there's anything that's in my report, if anything, there's sufficient evidence that what's currently happening is not getting the outcomes that are required. And there's sufficient evidence to know that better outcomes do not come because you change the name of a department or you create a new policy manual or you change the legislation. We've got all the evidence to suggest that doesn't bring about change. And what brings about change is relationships. You can look at your own personal life, anybody, what's been significant in your life. It's probably attributed to a significant relationship with someone. And as I used to say to my students, that's what social work is all about. It's about relationship building. And there are 4 key elements to relationship. There's respect, there's caring, there's trust, and responsibility. And the responsibility is key because relationship is not a feeling, it's an action. And you have to be responsible. In order to get respect, you got to give it. In order to be respected, you got to be respectful. In order to be cared about, you got to care for others as well. So it's all about relationships. And those relationships need to be developed within communities and within family support centers, within daycare centers, within the schools, within the medical clinics. They're all a part, everybody's interested in collaborating so that children are getting the best outcomes that they possibly can. We all have the same goal. We want the best for our children and for our communities, for our families. And relationships are key to doing that.
Thank you. I think that's a great place to end.
Ante se abjwa ma patena tente se esto quais nchane no en dante he mishana knisha kanis na ko hagan cha ka esto quais hina se jwa ma kan esto quais hina jwa na chikanis na ko ni ban niu cha an nan niu je ja shapan jin niu cha an wenji en esri je semto cha je ja abjman sen matoch ma kan de he an cha et kato se cha jeji nistan tato kuna jinte jeji michima wija do semto cha magana de jeji manotan to michima wente cha engo neshna kwa new chan de he chikana shna kuni bniwa eno de she jeji to kwa henta ni no naspedeni mon no mag jeji nagto en magto ya mag jeji tabo ha hanan cha tabo ta shona magan annan new chan eso tugan chi chagwan new cha dante she wamnestagan tukunan dan new charge kan situ tegni benua de wino onche meon mokon new chan an cheji an te cheji mushi sagan chan an chaka tegni benje new dan te an na speed and maton new den te he wino was ja tukuin den te he cheji nagatuen matoya wano agataga mag cheji na spihen mata tukuin den te he tukun new cha cheji we just the same to nan den te he wino no chaka to se cha and we with me ska se cheji non te he we just the same much den te he when den te would ga ma javish Ego da chaka to ni bin chi shwe ni ma kan den te he to hon javisha den te he ka to se cha ma kan te she a was jin te cha en gun was to de kan ni wa je ji man no trust jin te en gun de he chaka na shana gun ni bin ni cha dan te she una we te kan ji ano che kwa ma kan te she an man je shana kwa ni cha dan te je ji ta na je ji wi ja kan chin te na wi han shmo ma kan te she wasa en gun chaka na shana gun ni bin ni dan te mi shana ni dan te he me shana te pat kan ji mat to ka na ni we na ka to no ni en gun ni na je chaka he ji ni bin ya bi ni we na when I check out we huma and on the head to go and to seven at the 7 new channel the chagaji nishna kun you and I to go no ni chechi chagad the funny ban ni wa en kun an mamon dan te she chechi to ka ni chechi with the same to dan en kun chagad nishna kun ni ban ni wa kun to ko chen khamatin to ko
Thank you both very much. A special thanks to Dr. Barter and also to Victoria. Thank you for respecting and recognizing the need for interpretation and translation. That's really useful for us.
So Hey, what's your mouth? I said, what's your mouth says thank you.
Perfect. We'll ask lead counsel and Giles, what's next? Giles, do you go by mommy? Oh, you shy.
Thanks, commissioners. So I would suggest at this time that we take our lunch break and then we'll come back for questions from the province as well as Canada.
Okay, I'll ask Dr. Barter if you're good with an hour break. Will that work for you in your situation there?
Yes, I'm fine. Yes.
Good. Thank you very much. We'll be back in an hour, about 1:15 local time. Thank you again.